Hi everyone, welcome back to my YouTube channel and today we are going to talk about hypothyroidism. So let's start our topic with introduction. Hypothyroidism is a common endocrine disorder that is characterized by insufficient production or action of thyroid hormones. Thyroid hormones play a vital role in regulating metabolism, growth and development. When their levels are low, many body functions slow down, leading to a wide range of clinical manifestations. Hypothyroidism can affect individuals of all ages and is more common in women. Definition of hypothyroidism. Hypothyroidism is a condition in which thyroid gland fails to produce adequate amount of thyroid hormone, mainly thyroxine and triiodothyroxine, thyronine, to meet the metabolic needs of the body. This hormonal deficiency results in decreased metabolic activity and impaired organ function. Causes of hypothyroidism. The causes of hypothyroidism may be classified based on the level at which hormone production or regulation is impaired. First cause is primary hypothyroidism. In primary hypothyroidism occur due to dysfunction of thyroid gland itself. It is the most common cause in autoimmune thyroiditis, where the immune system attacks the thyroid tissue. Other causes include iodine deficiency, surgical removal of thyroid gland, radioactive iodine therapy, congenital absence of thyroid, and certain medications. Then there is secondary hypothyroidism. Secondary hypothyroidism results from inadequate stimulation of thyroid gland due to disorders of pituitary gland. Reduced secretion of thyroid stimulating hormone leads to decreased thyroid hormone production. Then there is tertiary hypothyroidism. Tertiary hypothyroidism is caused by dysfunction of hypothalamus, leading to insufficient release of thyrotrophin releasing hormone and impaired regulation of thyroid hormone synthesis. Pathophysiology of hypothyroidism. In hypothyroidism, there is a reduced thyroid hormone level that leads to a decrease in basal metabolic rate. Cellular metabolism slows down, affecting carbohydrates, lipid, and protein metabolism. Accumulation of mucopolysaccharide in tissue results in characteristic features such as facial puffiness and non-pitting edema. The cardiovascular, gastrointestinal, nervous, and reproductive system are also affected. Clinical features of hypothyroidism. The symptoms of hypothyroidism develop gradually and vary in severity. Common features include fatigue, weight gain, cold intolerance, constipation, dry skin, hair loss, and decreased sweating. Patient may experience bradycardia, depression, memory impairment, and menstrual irregularities. In severe cases, hypothyroidism may lead to myxedema, that is a life-threatening condition. In infants and children. In infants and children, hypothyroidism can result in impaired physical and mental development. Congenital hypothyroidism may present with poor feeding, delayed growth, and developmental delay. Early detection through newborn screening is essential to prevent irreversible intellectual disability. Diagnosis of hypothyroidism. Diagnosis of hypothyroidism is based on clinical features and laboratory investigation. Blood tests reveal low levels of thyroid hormones and altered level of thyroid stimulating hormones, depending on the type of hypothyroidism. Additional tests may be performed to identify autoimmune causes or structural abnormalities of thyroid gland. Management and treatment of hypothyroidism. The primary treatment for hypothyroidism is hormone replacement therapy. Synthetic thyroid hormone is administered orally to restore normal hormone levels. Treatment is usually lifelong and requires regular monitoring to adjust dosage and prevent complication. Lifestyle modifications such as balanced diet, adequate iodine intake, and regular follow-up are important aspects of management. Patient educations play a key role in treatment adherence. Complications of hypothyroidism. If left untreated, hypothyroidism can lead to serious complications including cardiovascular disease, infertility, anemia, hyponatremia, and myxedema, coma. In pregnancy, untreated hypothyroidism may cause adverse maternal and fetal outcomes. Prevention of hypothyroidism. Prevention of hypothyroidism include adequate iodine intake, early detection of congenital cases, and regular monitoring of individuals at risk. Awareness and early intervention can significantly reduce disease burden. Conclusion of this lecture video. Hypothyroidism is a common and manageable endocrine disorder that affects multiple organ systems. Early diagnosis and appropriate hormone replacement therapy can effectively control symptoms and prevent complications. Proper medical care, patient education, and regular follow up are essential for optimal outcomes. And this was all about hypothyroidism. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.